right when I moved, HIV hit. And it hit hard, and it hit hard in the community that I was really engaged in, and with the people that I was really around. And so San Francisco was a time of a lot of hopefulness and a lot of activism, but also a lot of death and a lot of people really, really sick, and the sense of community and the sense of kind of coming together in that moment. For me, those years in San Francisco were incredibly, incredibly life-shaping for me in terms of everything that had come before. But I would say that period is perhaps the most impactful in terms of my life, in terms of just recognizing, first of all, the discrimination that can happen from a society that ostensibly is not discriminating, and to recognize how that plays out in sort of a real way. So part of that then meant, how do you get Amnesty International, how do you get different organizations to recognize that HIV is part of their concerns? How do you be able to get these international kind of non-governmental organizations who do such a good job of advocating to be able to see the relevance of HIV? And then on the more local side, how do you get legal organizations who are concerned with people's rights to recognize that when they're not sure, that there's something about an international framework, something about what's happening in other places that can actually be useful in terms of figuring out the best way to react. So it's toggling between those two, and I don't want to pretend I had a major role. I was very young, but I was engaging in all of that in very concrete ways. And so by bringing in these issues, so starting with HIV, the first thing we had to do was to show that there were civil and political right violations that were happening, right? So that people were so to be able to talk about what was happening to people in prison, to be able to talk about what was happening around mandatory testing of certain populations. Those were things that human rights organizations were like, okay, it's different, it's public health, but I get it, right? But when you started to talk about access to medicines, and you started to talk about the ways in which discrimination impacted on people's vulnerability to becoming infected and what was being done, that was like, that is so not part of what we do. We're just not gonna, that is absolutely like outside the realm. And so I think, again, coming back to different actors, different strategies, what was really clear was that for organizations that were very civil and political rights oriented, it had to be a step at a time. And it had to be, okay, let's do what you're asking. Let's start with how we can show and document, right? Things that are traditionally within the work that you do, right? And then let's move it just one notch further and just show how there's a link. All right, let's just move it 2 notches further. And so it was about trying to move those human rights organizations to be able to do that. You had to start with a basic literacy around human rights and human rights standards, and what kind of the international system meant, as opposed to that you have a good heart, and that it was kind of what the frameworks were that were there for use. And then that you had to, depending on your audience, have potentially either or and something equally foundational in public health, depending on your audience. And then that you start to give people tools to think about the conceptual linkages, so that you do it at a conceptual level in terms of being able to get people to be able to see and work through exercises, to be able to actually think about how it is that they can work in synergy, and ultimately how it is that you can show that human rights can help you to have demonstrably better public health outcomes. There was not, amongst the human rights treaty bodies, there was not a general comment on the right to health. There was nothing, even though health had been recognized because it was in the Covenant on Economic, Social, and Cultural Rights. The way that it's written into the treaty was based in language from the 1960s. So it has things in there like stillbirth rate, and there's language that's sort of kind of old-fashioned, but also how it's articulated wasn't really explicit and really clear in important ways. And so the effort that happened to put together the General Comment 14, which still exists, right? Which is hopefully maybe one day we'll get it revised, but we worked really hard to get that General Comment into place, and that General Comment was important because what it did is it set up a general framework for understanding the right to health. I think the other hugely important piece in terms of the human rights piece was the Declaration of Commitment that happened in 2001, and I think that, you know, that isn't just UNAIDS, but it is UNAIDS in terms of, again, that being one of those political conferences in terms of the governments of the world and how what came out of that and what difference that could make. And what that conference did is, besides everything else that it did that we're not talking about, but besides what it did specifically in the human rights space, is that it allowed human rights to be something that governments had to report on in terms of how they were living or how they were concretizing their commitments under the Declaration of Commitment. What happened in the early 2000s was this idea of something called a common understanding. And so this idea that the UN was going to put out something called a common understanding, because there were so many different understandings, that there would be a common understanding of what a rights-based approach would entail. And it wasn't health specific, it was health and development, right? So it was kind of broader in terms of what it included, and it included all of those principles: participation, transparency, non-discrimination, privacy, and then kind of this little catch-all, which was, and other rights relevant to whatever the topic is, right? So that there was a space to be able to kind of bring in other pieces. And by the fact of this rights-based approach framework being out there, it allowed then for the agencies to kind of couch some of their work in that space. It allowed civil society to say, in terms of their organizations, if they did or did not use that frame, like to do something different. But it did give like a common anchor and a reference point in some ways for being able to put that out. And I think that the components of the rights-based approach, I think, are something that are, I think there's general agreement. I think there's a common understanding at this point about kind of what those principles are, but not necessarily how they should be applied, but what they are. And I think, and again, I think that's really okay. I don't think there has to be one way to do it. Bringing health and human rights together is much bigger than any one institution, right? That it's bigger than any one place, and that there's the possibility there isn't one way to do it. It's a little bit like this question about, is there one way to do health and human rights, right? And I think that at the beginning that there was this sense that because it hadn't been identified yet, that there was maybe one way. And I think one of the things that time taught me was, no, there are many ways. And I'm not sure that the Jonathan way or the Sofia way or the whatever is the way. There are ways. So the issue is and also when you're dealing with governments and you're dealing with institutions of power, particularly those that are not friendly to rights, what are the basic principles you take forward and you use no matter what, even if you don't call them rights? So transparency, accountability, a focus on non-discrimination. One of the things that I learned was really about how to think in a process way about those things in ways to bring them on, even if it's not so necessary always to say what they are, because sometimes that gets you in to places you might not be able to get to otherwise if you really want to make a difference.